Computer. A patient with a deep bite presented to clinic complaining of tooth wear and bracket placement. Which aesthetic bracket should have been used in this case? Patient with deep bite presented to clinic complaining of tooth wear after bracket placement. Which aesthetic bracket should have been used? Um, Deep bite, complaining of tooth wear after bracket placement. So if we go in the aesthetic, cobalt, chromium, no, stainless steel, no. So obviously it's a plastic bracket E. A 12-year-old patient came with his father to your clinic. He just had an accident during the examination. Found there is a cervical crown fracture on the upper left central incisor. According to the finding, what is the most appropriate management? Yes. So what is the management for crown fracture? There is no orthodontic involved. 4 weeks supplementary hole. So B. Yes. So that's why we skip ceramic brackets. This 9-year-old female presented class to deep to incisor relationship and general recession on one of her lower incisor. The radiograph showed that all permanent teeth are developing. What is the most appropriate plan to manage this patient? Provide upper removable appliance with anterior bite plane. Yes, we can do it because it will include the lower incisors and somehow also include upper incisor too. Provide an upper removable appliance with posterior bite capping. They will extrude the upper incisors, so that is not an option. Extract the lower right central incisor and provide an upper removable appliance with anterior bite plane. And extract the lower right lateral incisor and provide an upper removable appliance with anterior bite plane. What is it? Right central, lower right central incisor? I think the same options. Extract the upper lower right lateral incisor. Let me see which two. This lateral, central, central. So this is a central incisor here. Refer for periodontal for the gingival recession. I think first we should take the cause off, then we can do the gingival recession. And initially a bite plane can be given. And then when the cause is removed many times, like with the gingiva, there's some growth of the gingiva, and we can also do some periodontal like with treatment because it seems in mixed dentition. So I will go with provide an upper removable appliance with anterior bite plane. So anyone on this having another view? I think this is good. You just debonded the patient was for extract. What align archway properties particularly important in this patient compared to a patient where no extraction is done? Frankly, there is no difference, a large difference. And the property test is used is springiness or range, like what both are used there in the literature, right? When we went through the literature, range was most commonly used than springiness, but both things are used in the literature. That's why I'm going with springiness, but both things are used. It's a gray area. See. 20-year-old female attends for assessment. He has a mild class 3 skeletal pattern with more vertical facial growth. Although he has no difficulty in eating, he wants orthodontic treatment combined with orthognathic surgery. Your hospital will only fund orthodontic care to patients with great or very great need for treatment as index of IF14, which is the most appropriate outcome of this assessment. Has a mild class with a normal vertical proportion. I think the treatment cannot be offered as he is a mild need for orthodontic surgery. Cannot be at a moderate need and cannot be funded as a moderate need for orthognathic. Very great need, very great need. I think it's a mild need. Anyone? Fran, what do you
But I
say on
think
this?
we discussed this one before, but we choose B. Treatment cannot be funded as he is moderate, according to the IOFTN.
Sir, they have already mentioned that there's a mild class 3, so we will go with A option.
Yes, I think it's a mild class 3, so it would be mild. And we decided previously this is RNA attachment. Someone took a photocopy of it. And there's intrusion of the molar. There's uprighting of the premolar, uprighting of the canine, both the premolars. Canine uprighting, no, we are not sure about it. First molar intrusion or first premolar rotation, anterior anchorage, second premolar extrusion. I was sure about the extrusion attachment. Rest I was not sure that what they are doing because there is a bevel there. So I went with E previously. 13 years old female attempts to affix appliances. She had a mild form of amelogenesis imperfecta, although she has no areas of missing enamel. Her enamel is thin and prone to fracture. What is the most appropriate enamel preparation adhesive to use? No HN glass enamel cement. We discuss it. A. You are carrying out involving 12 years old boy whose treatment was not involved extraction of upper low and fixed appliances were fitted 9 months ago. His oral hygiene continued poor despite several visits. You notice some areas of decalcification in last appointment, which you brought to the attention of his dad. The visit you noticed that decalcification has worsened. So there are two options, like what you can give a VFR or this one. So we decided that remove his fixed appliances, take photograph, refer to clean up of the adhesive for 2 weeks, then discharge him to the dentist. Uh, Remove his fixed appliances, clean up the adhesive, and discharge him to the dentist. I think we decided for B. We're not going for deafening, so it's A is not a good option. B is the option or C was the option. Take photograph for right varnish, no. Remove attachment from the upper, no. So we went for B previously. I answered it previously, it was B. You have corrected a 14 years old girl unilateral posterior crossbite with a cord helix appliance. We decided that's 50%. Even yesterday, these MCQs were discussed. The most effective way in sterilization is, yes, Pran, ultrasonic cleaning, then 134 to 170 centigrade. So what is the time there? 3 to
Sir,
3.5 or 2 to 2.5?
sir, it's A, 2 to 2.5.
Okay. Class 3 patient with normal upper lower inclination, good profile. You are planning for an extraction treatment using class 3 elastic. What is the torque prescription you will use? It's the class 3 patient with normal upper and lower inclinations, good profile. So you are proclining the upper incisors and reclining the lower incisors. So you need decreased torque values on the lower, low torque on the lower, and high torque on the upper. A. Relapse in intermolar area of expansion with cord helix is not utilizing any mean of retention. Wait a minute. I think that was mentioned in intermolar. Give me a second. There was an article. I'm just trying to find the article. Intermolar, that is 30%. Two. 19 years old female, old male presented with mandibular asymmetry. His chin is deviated on the right side. There was also marked central line shift and a crossbite on the contralateral side, but no occlusal canting. Which of the following statement is correct? The patient would be demonstrate increased uptake on the left condyle. His chin is deviated on the right side. So there was no marked central line shift and a crossbite on the contralateral side, but no occlusal canting. So it's a hemimandibular elongation. And in hemimandibular elongation, chin deviation occur on the opposite side. So it's on the left side, I think, like what is the secantography. Like when you go for the radioisotope scanning and you will find it on the left side. I think 14 years old patient underwent gingival recontouring of the upper incisor. Carbonized tissue was left over the teeth. Which solution should be used in the carbonized tissue? Anyone for this one? Just give me a second. Let me check. Uh, so for carbonized tissue, it's hydrogen peroxide. 3% hydrogen peroxide. C. Type of following studies can be observational study: prevalence of missing lateral, relationship with gender and growth spurt, incidence of malocclusion, effect of bracket system in incisor torque, relationship between TMD and occlusion. There are many studies. I think prevalence of missing lateral incisor, like what is also observation in gender and growth spurt. I think there are multiple correct options. Generalized ability depend upon the research.
Sir, they have asked for don't represent.
Okay, can't be observation study. So it can be D. Generalizability depends on the research. Efficacy, efficient, effect, efficacy, effectiveness. I will leave this. First, I have to read English for this. A baby girl, aged 3 months, was referred to orthodontic department. The parents were concerned about the facial aesthetic of their daughter. On clinical examination, recorded that the facial feature of the baby include hypertelorism, underdeveloped mid-face, and there was a marked bulging of the eyes from the sockets. So it's a conrosion syndrome. It's a like what synostosis, what they used to say. Synostosis syndrome, frozen or apart. The most preferred method for the management of the patient should be surgery of the eyeball at 24, surgery to release the fused skeletal suture at 2 years of age, no treatment at this age, surgery to release the fused skeletal suture between. Yes, Dr. Junaid, what is written? Because it depends on the severity. They do all this surgery. It depends on the severity of the surgery, and later on they also do some, if required, distraction osteogenesis when the patient is adult. Because there are two types, two surgeries can be done in this patient, and it depends on the severity of the surgery. Surgery of the like what
I
existing
think they are indicating towards the early surgery because they've specifically mentioned about the eyeballs. So maybe they are indicating towards the early surgical intervention. So might be option B, 2 years of surgery. I'm not
Frankly,
sure,
I don't
but
know. There should be evidence for this. 20 years old patient with achondroplasia attends with a mother. Her mother wants her to have been treated so she can look normal. Before referring for craniofacial center, what would be your certain as outcome? Patient has received psychological consultation, airway obstruction management, leveling alignment. Patient has gone through pre-medical checkup regarding achondroplasia. Patient wishes and motivation. I think number one, patient wishes and motivation, because this is an adult patient, and then later on the other things will come. A baby has has a small lower jaw and chin with maxillary hypoplasia. His ears are very small. His eyes slant downward, and he has palatal cleft. He diagnosed with Draken-Pollard syndrome. The parents are concerned about his feeding. First step: modified teats. If it's this, then you go for the modified teats. Yes, they mentioned it. Considering a classical projection symmetry, X-ray tube on the right. We previously discussed this. X-ray tube on the right, film on the left. With respect to the lateral cap, which of the following statement is correct? The posterior border of the left ascending ramus appear mesial to the. So X-ray is on the right. So the X-ray, the right side is going to be more distal. The right side is going to be more downward. The posterior border of the left ascending ramus appears mesial to the right, yes, and the lower border of the mandible appears higher than the right. I think E is correct. The posterior border of the left ascending ramus appear mesial, yes, it looks smaller, and the lower border of the mandible appear higher on the right. The posterior border of the left ascending ramus appear distal. No, this is wrong. The posterior border of the left ascending ramus appear distal. No. The posterior border of the left ascending ramus appears mesial to the right, and the lower border of the mandible appears lower than the right. No, it's higher. So it's A. I cannot read. His parents have Saturday afternoon and explained that 2 hours traumatized teeth playing rugby. Radiographs, no. Currently too small on my screen. I'm going to skip this one. I think we have solved this one. Obviously, there's something. Check both inside. There is permanent dentition, but it's hard for me to read it. A 14-year-old female attends to a fixed appliance adjustment appointment. Her upper and lower fixed appliances were fixed 6 months ago, and her gene has always been good. Today, she has dinner info and generalized plaque deposited on the teeth. Her mother reports that the family is going through different. So we decided for D. You fitted this appliance. It's a quad helix and a unilateral. What is this? Your next step is to place an upper 1925 steel wire. What is the most appropriate adaptation to make the arch wire for this patient? So we expand the wire and then we add a buckle proof top. E. IoTN question. The jet is 9 millimeter and the orbit is increased complete to the palate and traumatic. There is a left side is Caesar bite effect in the premolar and severe lower arch crowding with contact point display. And it's all the permanent teeth apart from the third molar have erupted. What is IoTN? Yes, it's over to you. Yes.
Hello, sir.
Yes.
Sir, in that question where we answered that take out the arch wire until the next visit, can we go for carry out the fixed appliance right now and reinforce her oral hygiene, because this is the first time she is having a poor oral hygiene.
Yes. We decided this 2 or 3 days ago that we'll go for the arch wire removal because the patient cannot maintain the oral hygiene with the arch wire. And if we see the other option, that was reinforcement of oral hygiene, reinforce oral hygiene. Previously, we selected this option. But the confusion was this gray area, what they mean by
Yes.
reinforced, right? Oral hygiene. So if it was mentioned like what scale and polish, right? Then we might have went for C, but then we decided to go for E.
Okay, sir.
Previously, we went for
Thank
C in this case, but recently we changed our opinion about this question.
Okay, sir. Thank you, sir.
12 years old patient intend to start orthodontic treatment. You previously requested that the dentist extract the upper and the lower second deciduous molars to allow the eruption of the unerupted second premolar. When you examine the mouth, you see the dentist has removed the first permanent molar in the error. You believe that you can still achieve a good result, but it will take a little longer. What is the most appropriate to manage this situation? So you have to inform the patient and also to the dentist. Speak to the dentist, ask them to inform the patient that they extracted the wrong tooth. Yes, C is the right option. No, D is the option. Inform the patient and parents that the dentist has removed the wrong tooth, but that you believe you can achieve a good result. Then contact them. Yes, C is C. C. Yes, it's a zone of compression. The dotted blue line, it's taken from profit. The best to describe the area, zone of compression, B. So this seems to be here it seems to be like what first order band. It's a first order band to make it, I think, mesial in. Yes, it's a first. See, if the wire do not seems to have a vertical band here, it seems like what going inward. No, the wire came straight, it came outward, and I don't know, the other part is covered with the sleeve, right?
Sir, on the left central, there's a slant. This is going down mesially.
Then it's a first order band, the root is going in the mesial direction. Second order band, sorry. Then root is going in the mesial because the wire is up on the. A researcher in university is conducting a follow-up study on pregnant women. The period of study ranges from 9 weeks to birth. One group of women taking care of it, but the other is not. The purpose, we discussed this. This is a cohort. You recently experienced problem with a high number of patients who are returning with debonded molar tubes. We discussed this many times. Smaller bracket base because all the options are wrong. Okay. Okay, I think we are done here. This. Okay, that's done.